If you're someone who has had a cesarean delivery and will be having a repeat cesarean delivery in the future, this video is for you. I'm just going to give some pearls or words of wisdom regarding those who have had a primary cesarean delivery and are going to have repeat cesarean deliveries for their subsequent deliveries. As someone who's an ObGyn MFM, and I've been doing this a long time. Okay, look, everybody always asks me about scar tissue and the risk of scar tissue and risk factors for scar tissue. And I can tell you, there's nothing definitive. I've had patients with 5 prior C-sections or more with not a lick of scar tissue. And I've had somebody with 1 prior C-section with cement for scar tissue and adhesions everywhere. By the way, adhesions is another word, if you will, for scar tissue. So if you have had a prior cesarean delivery and you have decided to have repeat cesarean delivery for your next pregnancies, it's very important that you ask your surgeon, did I have scar tissue? If yes, where? Was any additional surgery needed to fix that scar tissue, or was any surrounding tissues or organs injured because of the scar tissue during your repeat cesarean delivery? For example, I just did a repeat cesarean delivery on someone at term who had had 2 prior cesarean deliveries. And her rectus muscles, which are the 2 bellies of the muscle here, should not be attached to the uterus, but hers were. They were completely attached to the anterior or front part of the uterus. So I had to do a lot of dissection and a lot of extra surgical maneuvers, if you will, to take those muscles off the uterus in order to even access the uterus to deliver the fetus. And in doing so, I got into a part of the uterus higher up that we normally don't go into. Her previous uterine incisions were lower in the uterus, which is where we want to make them. But because her scar tissue and the rectus muscles were so tightly adhered to that anterior uterine wall, I did get into the higher portion of her uterus, which is called the active segment. And that is a thicker area of the uterus, more muscular. That is also the area where we would go into if we did a classical incision on the uterus, which is up and down. And that makes that area weaker for future pregnancies. So because I had to repair that, and it was deep enough in my opinion, being the surgeon, I recommended that she deliver in her next pregnancy by 36 weeks because that area higher up in the uterus is potentially weaker and could be a potential site for uterine rupture in subsequent pregnancies. So we deliver them earlier in that situation. So that was thoroughly explained to the patient, and I always tell my patients, please get a copy of your operative report, just in case they happen to deliver somewhere else. They'll have a copy on them and accessible for their next delivery. So I'm curious, has your surgeon told you things like this, giving you these recommendations, or am I the only one?